I wish I could give you a very pretty picture of why I decided to run for office, but the truth of the matter is, it's a very ugly story.
Bakersfield doctor Jasmeet Bains says she never imagined herself venturing into the world of politics.
It's the story of a physician who has had enough.
Until March 2020.
What I have seen over the past 2 years, the amount of suffering I've seen, the devastation on my community is more than most people see in their entire lifetime.
Bains is the daughter of immigrants from India and grew up in Delano. The COVID-19 pandemic became the impetus for her to throw her hat in the ring to represent Kern's newly drawn 35th Assembly District as a Democrat.
It really came down to either I continue being a doctor for my community or I take my voices, my experiences of my patients to a higher level.
Bains says providing medical services to the underserved in the Central Valley has been the driving force of her career. She did her medical school residency at Clinica Sierra Vista here in Kern. Now, she is the medical director at Bakersfield Recovery Services, where she works as a primary care doctor and provides help to those recovering from addiction.
You have a pail that has holes in it and you keep putting water into it. It's just going to keep leaking unless we address the holes in the system first and plug it up so that when we're ready to put water in it, it holds.
That's how Bains describes the nation's healthcare system, which, perhaps unsurprisingly, is the issue that, if elected, she would most want to tackle in office.
So we got to make sure we work towards making healthcare more affordable and more equitable for everyone, and that's not going to happen overnight.
She believes her lack of a political background gives her an edge in the race and a fresh perspective if sent to Sacramento.
We have to fix it by electing people that know how to fix it, that have worked in the system, that have worked and seen patients in the healthcare system.
But Bains, who also serves as the chief medical officer for the California Medical Disaster Team Central Valley Unit, says healthcare is far from the only issue she would want to address in office. She says, if elected, she would also prioritize homelessness, water infrastructure, and air quality.
Homelessness is on every voter's mind right now. What do we do? What do we do? Homelessness is not just an issue of not having a home. It's about having access to resources to rehabilitate a community that's suffering during one of the biggest mental health crises in U.S. history. I actively do that. I run a recovery services. I'm the medical director of Bakersfield Recovery Services. We must invest more in recovery centers. We must make healthcare more equitable. Trying to get addiction treatment services under the current healthcare system is so hard. It took forever for them to even realize that addiction services is considered a mental health problem. So there's a lot of things that we had to do to fix the homelessness issue. Rehabilitation is on the top of that. Water infrastructure. Central Valley feeds the world. Our farmers, our rich culture in the Central Valley is the reason why California proudly calls itself the 5th largest economy. Yet, we've done nothing to sustain that. The fact that our farmers are trying to scratch their heads on trying to water their crops is unacceptable. Investing in good water infrastructure system, making sure that water is there to feed our crops so that California continues to be the 5th largest economy is very important. In addition to that, fixing our supply chain issues. Farmers tell me all the time, they've got crops, they can't ship them out. The ports have been an issue for very many years. This is not new. They got worse during COVID-19, but it's been an issue for more than 10 years. Our ports need to be fixed, our trade needs to be fixed, and then air quality. I sit as a current representative on the Environmental Justice Advisory Group. I've been fighting for air quality, for better air quality in the Central Valley for a very long time. Central Valley has the worst air quality in the country. The amount of chronic obstructive pulmonary disease in the Central Valley is alarming. The reason why COVID-19 was so detrimental to the Central Valley over other areas is because of the alarming amount of underlying lung disease already present in our community. Central Valley got hit hard by COVID-19, I know it. I ran the field hospital for COVID-19. The Medi-Cal system, the healthcare system in general, is broken. The way mental health and physician burnout is on the rise big time. And a lot of that is the fact that we have to fight so much in the system just to provide the care for our patients. I'll give you an example. I had a patient, she was 14 years old, first time pregnant, lost, doesn't know what to do. She came in to see me, had a complicated urinary tract infection. We know if you don't treat those in pregnant women, it can increase your risk of miscarriage. I had some of her cultures from, I had gotten her urine culture and it was sensitive to a certain antibiotic, so I put in the prescription for that antibiotic. It was a Friday evening, she went to the pharmacy and the pharmacist told her your health insurance is not going to cover it because your doctor should have chosen a cheaper antibiotic. But I knew she needed that antibiotic due to the culture of her urine. She didn't get the antibiotic and in the interim she lost the baby. This is just one of many stories. Who's going to take responsibility for that life that was lost? There's so many stories of why I'm running for office. Healthcare system is broken and we need to fix it. And we have to fix it by electing people that know how to fix it, that have worked in the system, that have worked and seen patients in the healthcare system. Look, I'm not a politician. I'm a doctor. I'm a business owner. I'm a woman. I'm the daughter of immigrants. I'm a minority. I'm not a politician. But I think at this time, we need change. Well, first of all, we gotta fix the system. Healthcare is suffering because it's not affordable. It's not accessible. So we gotta make sure we work towards making healthcare more affordable and more equitable for everyone. And that's not gonna happen overnight, nor is it gonna happen by a particular plan. It's going to take looking at exactly what makes healthcare so cost heavy and making sure that that burden doesn't go towards a patient.